Hello, this is Richard Franco, and this is my capstone report and proposal over the preferred communication methods in the emergency department at Piedmont Atlanta Hospital. This is for spring semester 2023 Informatics 700 for Dr. Vick's class at Mercer University. So Piedmont Atlanta Hospital is a nonprofit organization that serves Atlanta, Georgia, and over 80% of Georgia's population, with more than 37,000 dedicated employees. This organization provides treatment to 3.4 million patients across 1,400 facilities, including 22 hospitals, 65 urgent cares, 26 quick care sites, and over 1,800 Piedmont clinics. So about the study at this healthcare system, it focuses on the communication methods in the emergency department, where good communication among healthcare providers is critical for providing quality care to patients. The study examined three communication methods used by providers: the EPIC secure chat messaging system, phone calls, and text messages. The goal was to determine the most efficient and effective way for providers to communicate. That was just the ultimate goal. The study asked providers about their preferred communication method and their experience with each method to identify the best method to use and to improve communication in the emergency department. So my design methodology was a mixed methods design that was focused on quantitative research and had some qualitative system workflow analysis kind of sprinkled in there. It was a survey-based approach that collected user data, and the sampling was limited to emergency department personnel and practitioners who use the secure chat system. So compared to other research methodologies, such as case studies, experimental research, and other forms of qualitative research, we focus on quantitative survey design because it offered several advantages. One of these advantages was generalizability. So the results obtained from using the quantitative survey study, it could be generalized to a larger population. Also, reliability. Standardized survey instruments and sampling methods enhance the reliability of the study's findings. And the use of the same survey instrument across different sites can also increase reliability. So we were thinking more, broad stream. If it needed to be used at different facilities, this design could work as well. Objectivity is another advantage. The quantitative survey design is less prone to researcher bias and subjectivity, as the survey questions are standardized and administered consistently across participants. Lastly, we used this design because of its statistical analysis advantage. The use of statistical techniques in analyzing the data collected from a survey provides an objective way of analyzing and interpreting the results, right? The quantitative design incorporating a survey, it's designed to collect numerical data, which can be analyzed using statistical techniques. And in this case, that is an advantage. That being said, qualitative research can also be valuable in this study because they allowed us to gain an in-depth understanding of participants' experience and their perspectives regarding the secure chat messaging system in EPIC. One approach to conducting this research was to create and analyze workflows for the secure chat messaging system, and it helped excuse me, identify specific areas where the system could be improved or streamlined. It also showed us bottlenecks so that we could enhance the communication among healthcare providers. So a total of 34 participants responded to the multiple choice survey, which was a surprising 95% response rate. Of the 34 participants, 15 were emergency department physicians. The remaining 19 were registered nurses, all of whom worked full time in the emergency department. All respondents were users of the secure chat messaging system and phones. It's important to note that only physicians use text messaging as a means to communicate about patient care. And when they did so, they only used their private phones in this manner. The survey consisted of 6 questions that were asked of each participant, and no participants expressed difficulty or any confusion answering any of the questions. And of course, informed consent was acquired for each participant prior to the start of the study. So let's get into some of the data. Providers felt that phone calls were more effective at conveying patient information. Over 70% of participants chose phone calls over the Epic secure chat messaging system and text messages. The findings that phones are still the preferred mode of communication among nurses and doctors in the ED is significant in the context of this research project. It suggests that there may be some resistance to adopting new technologies like the Epic secure chat messaging system and text messaging, even if they offer advantages such as increased security and efficiency. One possible explanation for this preference is the immediacy and responsiveness of phone communication. Over 63% of providers indicated that speed was the reason they chose phones as their primary way to communicate with other staff members about patients. In the fast paced environment, like emergency departments, where timely communication is critical, the ability to quickly pick up the phone and speak directly to someone may be preferred over typing out a message in a chat system. This could be especially true in urgent or time sensitive situations where quick decisions need to be made. Additionally, there may be a perception among staff that phone communication is more reliable and less prone to technical issues or delays compared to digital communication systems. Lack of cell phone service for certain providers may contribute to the preference for in house phone usage as well. Previous negative experiences with the secure chat messaging system or text messaging systems might have reinforced this perception, making users reluctant to use them in the future. The study found that the average response time for phone calls was significantly faster than the response time for the secure chat messaging system. The mean response time for phone calls was 5 seconds, while the mean response time for the secure chat messaging system was 40 seconds. So, in looking at this workflow we developed, the RN opens the patient chart, accesses the secure chat messaging system, sends the message, and this is where the delay was. It took around 40 seconds in our observational study for providers to respond to this message. They could be in a patient's room and while the message waits at the computer and have to come back to the computer to read the message and then reply, or they were in the middle of a task and decided to wait before responding to the message or reading the message. And then once they read the message, they chose to respond. Um, in our observational study, we had a total of 10 respondents or 10 participants, and each was assigned to a random group, either the phone group or the secure chat messaging group. Some physicians, or I would say some providers, responded to the message immediately, while some took upwards of 2 to 3 minutes while they were doing other tasks or were away from the computer. So this drove the mean response time up to around 40 seconds, while phone calls was consistently around 5 seconds. So upon further analysis, and based on these findings, it was concluded that phone calls are still the preferred mode of communication in healthcare setting due to their faster response times and reliability. The results suggest that healthcare organizations should either prioritize phone communication systems over the secure chat messaging system or make the secure chat messaging system more reliable and responsive. So, based on the research showing that these phones are still the preferred mode of communication, primarily because of their response times and their speed, it was observed that the Epic secure chat system was not being utilized to its full potential. One possible reason for this could be that the messaging system lacked a reliable notification system to alert providers to new messages, leading to delayed responses and potential patient harm. To address this issue, we proposed to introduce a push notification system for the secure chat messaging system. The proposal was based on the idea that push notifications could potentially increase the secure chat messaging system response times and usage, and thereby increase overall satisfaction with the system. By enabling push notifications on assigned mobile devices, that's the key thing. It would be on their mobile device, their assigned mobile device. Providers would be alerted in real time to new messages, allowing them to respond more quickly and efficiently to patient needs. The proposal takes into account the preferences and needs of providers based on the research findings that showed that phones are still the preferred mode of communication in the emergency department. By leveraging the ubiquity of mobile devices and the speed of push notifications, the proposal seeks to enhance the functionality of secure chat messaging system, not replace it, by making it more reliable and responsive communication tool for providers in the ED. Providers also showed positive interest in the idea of push notifications. Providers, they may be showing this interest in the secure chat messaging system when push notifications are implemented because it offers a more efficient and reliable way to communicate critical information. The push notification feature alerts the provider to new message immediately, ensuring that they are always up to date with the latest information. This can help reduce response times, improve patient care, and enhance the communication in the ED. The fact that providers would be assigned a dedicated mobile device that works in all areas of the hospital is also a significant factor in their interest. Having a device that is always accessible and reliable ensures that they can always be reached regardless of their location. This means that they can communicate with their team members more easily even if they're not physically present in the ED. Oops. So, after conducting our research in the emergency department of Piedmont Atlanta Hospital, we found that phones remain the preferred mode of communication among providers due to their quick response times and efficiency. However, we also found that the Epic Secure Chat messaging system was not being utilized to its full potential. Our study revealed that the Secure Chat messaging system was not being used as much as we initially thought. Providers showed a preference for phone calls due to their speed and reliability. This finding is consistent with prior research that has been conducted on communication methods in healthcare settings. Despite this, we believe that the secure chat messaging system has the potential to become a valuable tool in the emergency department if utilized effectively. So, to increase the secure chat messaging system, the use of the secure chat messaging system, we propose the implementation of push notifications that would be sent to providers assigned mobile devices. The idea behind this was to improve the reliability and responsiveness of the secure chat messaging system. Our survey results revealed that providers were willing to use the secure chat messaging system more frequently if push notifications were implemented. In conclusion, our research has shown that phones still remain the preferred mode of communication in the ED. However, with the implementation of these notifications and the use of the secure chat messaging system, providers may be willing to utilize this tool more frequently. It is our hope that this research will lead to the continued improvement of communication methods in healthcare settings, ultimately resulting in better patient outcomes. So, the success of this proposal was made possible thanks to the participation of the providers at Piedmont Atlanta Hospital. We would like to take this opportunity to extend our gratitude to all the providers who took part in this study. Their willingness to participate and provide feedback allowed us to obtain valuable insights into the communication methods utilized in the emergency department. We would also like to express our gratitude to the managers at Piedmont Atlanta Hospital who allowed us to perform this study. Without their support, this research would not have been possible. Dr. Jeffrey Euler and Nora Hoxa were instrumental in ensuring the success of this study, and we extend our sincerest thanks to them. I'd also like to express my sincere thanks to Dr. Vikraman Bhaskaran of Mercer University for his teachings, his experience and guidance, but most of all, his patience with me throughout this journey in the informatics program at Mercer University. This path has led me to experience tremendous growth personally, professionally, and intellectually, and I appreciate all this program has offered me. So thanks again, Dr. Vic. And lastly, I'd like to thank you, the listener. Thanks for making it this far in my presentation, and please feel free to reach out to me with any questions. Thanks again.